Ministry of Health says there's not enough data to support calls to declare cancer a national disaster.
This even though about 47,000 new cases are reported yearly, and which result in about 32,000 deaths.
NTV's Kennedy Mureithi reports that the cancer scourge has now become something of a talk shop for leaders in the country, and more so following the death of a prominent person.
For eons now, public discourse around the fight against cancer resurfaces every time a prominent person succumbs to the disease, and recommendations made during the emotional period put in a shelf to gather dust until the next time another death occurs. The death of two prominent Kenyans last week and this week has once again reignited the conversation, with everyone, including specialists, taking every available opportunity to have their voice added to those of the grieving family.
Masaratani imekuwa sasa janga la kitaifa. Nataka kumuomba Mheshimiwa Rais achukue nafasi hii. Tumepoteza Mheshimiwa mjumbe wa Kibra, sasa tumepoteza Governor wa Bomet, watu ambao insurance covers yao ilikuwa na uwezo ya kuwatibu na kuwalipia.
However, the government hopes to settle the debate altogether.
For us to be able to reach a point of declaring this a national disaster, there has to be sufficient data built over time, and that is disaggregated. That is also indicating the causes, that is scientific, that is solid, that is sound.
Speaking at her office at the Ministry of Health, Cabinet Secretary Cecily Kariuki said emotions that accompany the deaths occasioned by cancer were high, but the parameters to declare it a national disaster were much lower.
We also move away now from the issue of high emotions because of lack of information, and we begin then to actually interrogate the information that we have available a little bit further, dissect it a little bit further, and we have the experts speak to the population.
Specialists in the field have also raised concerns about the rising cases of cancer in the country, calling for immediate intervention. According to government data, there are 48,887 new cases of cancer diagnosed in the country every year. 32,987 of these cases result in deaths. This translates to about 80 people per day. Some 3,200 children under the age of 18 are diagnosed with the disease every year. The country has only 35 oncologists.
If we want to actually have an impact in reducing these deaths that we are seeing currently, we need to have funding for this.
Though the government is admitting that over 30,000 people are losing their lives due to the different strains of cancer we have in the country, it says it is in the process of setting up radiotherapy centers all over the country in an effort to bring down the number of Kenyans traveling outside the country seeking this treatment. This is, however, not the first time the promise has been made. In 2016, President Uhuru Kenyatta, in a joint communique with visiting Indian Prime Minister Narendra Modi, promised to set up a cancer center that has to date not taken off. In the 2018-2019 financial year, the government set aside about 400 million shillings to set up regional cancer centers, but little is there to show for it. A 5-year cancer strategy was launched for the years 2017 to 2022, but little has been implemented this far. These efforts have put into question the seriousness with which the government is taking on the disease. Today, CS Kariuki inaugurated the National Cancer Institute Board, gazetted in April this year, which hopes to harmonize and implement some of the ideas of fighting cancer. Kennedy Mureithi, NTV.